Welcome to Med in 5. The goal of our channel is to simplify medical concepts and help you understand them headache-free. Today, we're discussing influenza and parainfluenza, viruses that share a name but are genetically different. Try these cues before we start. Which bug gives rise to the hallmark seal bark cough? Which virus is feared for its epidemic potential? Hang tight. Despite their names, influenza and parainfluenza aren't relatives at all. The term parainfluenza came from the 1950s, when childhood respiratory illnesses all resembled the flu. Later, we learned that these bugs were very different, but the name stuck ever since, still confusing learners today. But that's why we're here, to untangle flu from Paraflu. The influenza virus, aka flu virus, is an enveloped, segmented, negative-sense RNA virus from the Orthomyxoviridae family. Parainfluenza or Paraflu is enveloped too, but non-segmented, belonging to the Paramyxoviridae group. Influenza uses hemagglutinin to enter cells and neuraminidase to exit. The H and N proteins also define strain names, like H1N1, and genetic changes that create new strains. Parainfluenza uses a combined hemagglutinin neuraminidase glycoprotein for attachment and release, plus a fusion protein that forms syncytia or giant fused respiratory epithelial cells in the airway. Both viruses spread through respiratory droplets, though flu also transmits via aerosols and contaminated surfaces. Neither virus is strongly linked to cancer. Influenza has sparked epidemics and pandemics in 1918, 1957, 1968, and 2009. Outbreaks arise because the flu's segmented RNA genome allows antigenic drift, or seasonal mutations, and antigenic shift, where gene reassortment produces novel strains. Flu hits hardest in infants, older adults, the immunocompromised, and those with chronic illnesses. Influenza A is the most severe, with added danger from its ability to cross from animals into humans, sometimes leading to pandemics. Examples include the 1918, 1957, and 1968 pandemics, all traced to bird strains, and the 2009 swine flu, the only major crossover from pigs. Influenza B, confined to humans, causes seasonal outbreaks, often in children, but is generally less severe. Influenza C infects humans and pigs, but typically produces only mild, cold-like symptoms. After an incubation of 1 to 4 days, flu illness lasts 5 to 7 days, though cough and fatigue can linger for weeks. Typical symptoms include sudden high fever, chills, headache, muscle aches, malaise, dry cough, and sore throat. Complications include viral and bacterial pneumonia, myocarditis, aseptic meningitis, encephalitis, and Reye syndrome in infected children given aspirin. Flu symptoms mimic many respiratory illnesses, so a clinical exam alone may not be enough for diagnosis. Confirmation relies on rapid antigen tests, PCR, viral culture, or serology. Testing is vital, as flu antivirals don't work on other viruses. Treatment uses neuraminidase inhibitors such as oseltamivir or zanamivir, baloxavir, and supportive care. Prevention focuses on yearly flu vaccination, either inactivated or live attenuated, plus hygiene. High-risk individuals may also receive prophylactic antivirals to lower infection and complication risk. Next is parainfluenza. Paraflu mainly affects infants and young children, especially those younger than 5, and the immunocompromised. After an incubation of 2 to 6 days, symptoms peak within 3 to 5 days, and typically resolve within a week. HPIV1 causes classic laryngotracheobronchitis, aka Croup, with seal bark cough, stridor, and steeple sign on X-ray. HPIV2 causes milder croup. HPIV3 leads to bronchiolitis and pneumonia in infants. HPIV4 usually causes mild upper respiratory infection in older children and adults. Complications arise mainly in patients with severe symptoms or immunosuppression, including airway obstruction. Overall, Paraflu tends to be milder than flu, but can cause serious respiratory distress in vulnerable people. Clinical exam alone is often enough since no specific antiviral exists. But vague cases may require confirmation by PCR, direct immunofluorescence, or viral culture. Treatment is mainly supportive, including humidified air, corticosteroids for croup, antipyretics, and nebulized epinephrine if severe. Unlike flu, there's no licensed Paraflu vaccine. Preventive measures include infection control and hand hygiene. Let's review. Which bug gives rise to the hallmark seal bark cough? Answer: Parainfluenza. Which bug is feared for its epidemic potential? Answer: Influenza. Nailed both? Bangin'. Liked this clip? Tap like, share, and subscribe. Check out the comparison table from the link in the description. Thanks for watching.